Good afternoon. My name's Peter Ashby and I'm going to do the foreign body obstruction airway protocol dealio. So obviously we're going to do scene safety before we get there, wearing appropriate PPE, goggles, gloves, mask in this environment or anything airway related. When we get to the scene, we're going to try to gain consent, but you know, someone hands you their baby, that's consent. We want to see if they've got effective coughing. So if they can effectively cough, we're going to encourage that and continue to cough. We're not going to bump and jostle that baby or child around or human around, and transport them as is with a bit of supporting oxygen if they require it. If they don't have an effective cough, we're going to start off with back blows. So obviously hold a child upside down, going with gravity. An adult, you can put a small child on your lap to get this done, or an adult, you can ask them to lean over if they're still conscious. Between the scapula, upward action, downward tilt with gravity. So you want to do 5 good back blows and check each time between the blow to see if you've had any success. It's no good beating a child when they don't need beaten. So 5 of those bad boys while the patient is still conscious. Okay. If that hasn't dislodged, then you move on to chest thrust. So bottom of the sternum, third of the depth, firmer than that. Each time, again, checking if it's dislodged, because you don't really want to be causing more trauma when you don't need to. Dislodge. At this point, of course, you probably have your partner calling for backup anyway, getting IC moving towards you, because it's actually a real deal choking. If they become unconscious and they don't have a palpable pulse, you start CPR. You can do the airway thing in between coaches. So they do have a palpable pulse, but they're unconscious. Get them on their back, lift them up. You want to have your laryngoscope. You want to make sure the light that should have been done pre-check. You want to make sure your forceps are here, your McGills. There's 2 different sizes, a PD size and an adult size in our kit at the moment. With the blades, you want to select the correct blade for the size of the person's anatomy. So the straight Miller for any child under the age of 6 months. We've got the size just above it, which is a Mach 2, it's curved. Anything 6 months and up to a medium-sized child. Anything from that size onwards up to a small adult or female, we'll go Mach 3, I believe, and Mach 4 is for large adults, big islanders, large males. So hook it in, make sure it goes all the way in. You should get a light at the end of the blade. You want them in a sniffing position. You want to remove any dentures out of the mouth. Okay. So you want to go in, sweep the tongue away from the patient's right to their left. You want to get into the vallecula. Touching that should pull the epiglottis up towards your blade. Now you're not prizing on the teeth, but you're lifting upwards and towards, they say 40 degrees, but up towards the chin is good, lifting the anatomy away. You should be able to visualize the object and possibly the vocal cords. With the forceps, you go in closed. If you can't visualize the object, you can't grab the object. Without touching the vocal cords, because you cause them to spasm, gently grasp the object, pull the object out. There you go. And remove the blade. You probably don't have too many attempts on this because you can aggravate the anatomy and also you can waste time. So if you're successful, you support the patient, a bit of oxygen. If you're not successful, you're going to continue your CPR all the way to hospital and move your booty.